How many people here have fibromyalgia? Could they stick up their hand? How many people here know what caused their fibromyalgia? The question was, how many people here have fibromyalgia? And the second question was, how many people here know what caused their fibromyalgia? Okay. We're going to talk about fibromyalgia for a bit now. This is a test I use on all of my patients, and it's free. And this thermogram is in the Museum of Nature, about a mile away from my house, half a mile, right downtown. And I send them there with a camera, and with their own camera. And I say, take a picture of, in this case, your daughter. And this is the dad. You see the blood circulation going right to his fingers. And here you have literally no blood in the forearm, no blood in the hand to speak of, and zero blood in the fingers. This is a classical case of severe Raynaud's. There's someone here who does Sjogren's syndrome, which a lot of ME patients have, is typical of this. This is why they feel horrible all the time, because they don't get blood to their extremities. And when you don't get blood to your extremities, not only do you not function well, but you still break down tissue, and that tissue sits there, and it doesn't get recirculated. So this is a real just a fun thing I do. And when you're in medical school, well, when I was in medical school, one of the first things that they taught us was when you're interviewing any patient, you say, what makes it worse? What makes it better? And how did it start? And what makes it worse and what makes it better are really two good questions, because they lead on to a lot of other things. And for instance, those of you who've got fibromyalgia, we're only talking about fibromyalgia right now. How many know the exact viral, bacterial, genetic, or immunization cause of their disease, if they know that? And can you prove any injury to your physiological system if you've got fibromyalgia? It's a really important question, because if you've got something, there must be a proof to it. You must be able to show it. And which organs of your bodies have been injured and in what manner? These are routine questions that a doctor should not ask the question of the patient, but should ask himself or herself. And let's talk about fibromyalgia, not the definition, but what it is. It used to be called, as one of the gentlemen here said, fibrositis, until about 25 years ago. But it's non-articular muscle pain. So muscle is really important, and pain is very important. Arthritis is the joints, the articular. So this is not the joints. This is the muscles, the soft tissues in the body. It's not the... You can have arthritis and fibromyalgia at the same time, but most people with fibromyalgia, their worst problem is their muscle and soft tissue. But the question then comes, and I'm trying to teach you a little bit about why you have fibromyalgia. Because it's really important. If you know that, you can then avoid some of these things. What makes you worse? And very few of these people drink. And is there a relationship to that and fibromyalgia and to ME? And the next thing is, to worsen fibromyalgia, one of the things you could do is expand the vascular system. And you can do that really nicely watching a football game and having a few beers and eating salted potato chips. Because what that does is the salt in the potato chips, salt in the beer, and that increases your pressure. The beer doesn't leave you. And so your blood system expands, usually in your legs and your arms, in your gut. And when that happens, these people are in much more pain. If you feel better after the beers,
and the potato chips, you don't have fibromyalgia, you have dysautonomia. So it's a simple way to, or I shouldn't say you may have dysautonomia, which is what a lot of ME patients, so already looking at ME and CFS, we've made a division here, even talking about fibromyalgia. There's those that respond to alcohol and those that don't. Those that respond to salt, those get worse. So already you're subdividing ME's chronic fatigue syndrome, but it gets better than that. The best way, and my patients must love me for this, is if you do a Persantine Myoview stress test on them. Have anybody here with fibromyalgia had a Persantine Myoview stress test? Stick up your hands if you have. Are you lucky? Because what happens with Persantine is when you're doing a stress test, like putting people on a bicycle or on a running treadmill to get their heart pumping fast, a lot of ME patients will say, I can't do that. There's no way I'm getting on a running machine. I'll be dead for the next week. And so what you do with them is you lie them down, you inject them with Persantine. This immediately expands the blood vessels in the legs and the arms and the gut, and the heart has no blood. And so the heart says, what the hell's going on? And it speeds up as fast as it can, like you were running the marathon, the 4-minute mile. And you can get a good idea of what the coronary arteries are doing in the heart and whether you're setting yourself up for a heart attack or not. But when you do this to a fibromyalgia patient, they're ready to kill you. They scream, stop it, stop it. They try to get off the machine, and their pain is so intense. Their fibromyalgia becomes the worst thing you could possibly get. And it is horrible. The nice thing about it, if there is anything nice about it, is you give it another injection which counteracts the Persantine, and instantly the pain goes away in some people. Some people it lasts on for a week or so, and it's terrible. And it's terrible, terrible fibromyalgia. So what I'm telling you is fibromyalgia is a problem in the muscles of the blood vessels alone. And neurologists look at people with fibromyalgia and say, well, I've got pain here. Oh, you must be imagining it, because that's not in a neurological distribution. And it isn't. It's in a vascular distribution. So this is really, really important stuff. I don't know why the rheumatologists haven't triggered to this. So fibromyalgia is a pathological hyperelasticity of the peripheral vascular system, and anything that causes this expansion makes it worse. Now we get into the interesting stuff. One of the common things is genetic disease, and one of the genetic diseases which is associated with this is a disease called Ehlers-Danlos syndrome. And I always check people for this. And why don't we check you people? Can everybody stick out their tongue? Don't be shy. Come on. Okay. Can any of you stick out your tongue and with your tongue touch your nose? Anyone? Bravo. Bravo. These people have another medical problem which is really important to know. What they have, not with your finger, with your tongue. What they have is a hyperelasticity of the interstitial tissue. And what that means is their ascending aorta can become flabby. They can have problems of pumping blood around. So anybody who can stick out their tongue and touch their nose with it should go to their doctor and say, I want an echocardiogram and I want you to look at my ascending aorta. Because therein lies the problem to these people. But that's one group, only one group with fibromyalgia. Autoimmune or chemical injury to the arterial walls. This is essentially what it is. And what knocks out this receptor, or is it the chemical messenger that triggers this receptor? It can probably be both things. This occurs when you have a diffuse encephalitis.
The brain, which produces these hormones that tells your blood vessels to contract, has been injured by this encephalopathy that ME-type people or acute onset chronic fatigue syndrome people have. So what we're looking at, again, in fibromyalgia is a central nervous system injury to the arterial messenger system. Now you can have secondary fibromyalgia, any injury to the spinal vertebrae and its appendages. Now, the nerve endings for your entire body come out of the posterior tracts of the spinal cord. It is absolutely important, anyone who's having fibromyalgia, to have a simple x-ray of their entire spine, and not just anterior, posterior, but oblique views as well. Because a lot of these people with fibromyalgia, they don't have fibromyalgia. What they've got is all of the symptoms of fibromyalgia, but it's really caused by nerve injury of the nerves that pick up pain as they come out of the spinal cord. And this also tends to be genetic, but not always. It also occurs 10 years after a motor vehicle accident. If you have a motor vehicle accident and you come out and say, I was fine, just had a bit of whiplash, and you complain a bit, and a week or two after you're still complaining, but 6 weeks after you're feeling better, what has happened in that automobile accident is you've hyperextended the spinal cord, particularly the neck, and you rip out all the small arterioles, the capillaries going and feeding the bones in your spine. So the insurance companies want to get you checked and x-rays right away, and there's nothing there, no fractures, you're going to be fine. We'll give you a couple $100 to buy. Nobody should ever sign a permit for that, because they should come back 5 and 10 years later and do the x-rays then. Because that's when, because there's no blood supply to the spine, because of that seemingly minor accident, what you have is you have disintegration of the micro-artery capillary system of the bones of the spine, and you start getting arthritis during the entire spine, and this causes you fibromyalgia. It's easy to pick up with a simple x-ray, and if you've got fibromyalgia, you haven't had it, this is what you've got to do. And the other thing is pharmaceutical injuries to the muscle, and this is really important. And this is some of the causes of fibromyalgia. So, radiological evidence of spinal traumatism, fractures, or anything treated with NSAIDs, non-steroidal anti-arthritic medications. This is one of the biggest causes of rheumatoid-like arthritis and fibromyalgia known to God and man. It kills people. They get inflammation of the arteries and they die. And I've had recently a young mother die because her doctor gave her an open prescription of NSAIDs for a minor automobile accident where she suffered considerable pain from it. And she got the NSAIDs, took all the pain away, but she kept on it for about 8 months, and she killed all of the blood vessels going to her intestines. She became totally deaf. We got her a cochlear transplant so she could hear her kids again, and I was too stupid to pick up that we should have done at the time. We couldn't have done much about it. The arteries going to her kidneys, and everything shut down. She was totally constipated because the arteries going to the intestines were gone. All on NSAIDs. I've already talked about persantines, but if you look at drug-induced lupus on your computer, you'll find hundreds of medications that can cause lupus. Now, what they say is you stop the drug, the lupus goes away. This is not my experience. In some of them it does, some of it doesn't. This genetic disease I've mentioned, Ehlers-Danlos, HLA-B27. Have any of the people with fibromyalgia had an HLA-B27? Simple blood test? Yes? Yes? You have. Only one. This is a very common cause of ankylosing spondylitis. There's more than one cause of ankylosing spondylitis, but this is the most common. And this and psoriasis gives chronic, even if you don't have the spots, if your family has psoriasis, even if you don't have, there's a good chance that you're going to have fibromyalgia as well. So we're looking at genetic illnesses here. And this is all important information to know. And then there's the autoimmune diseases I mentioned. Rubella immunization. One of the best ways to cause rheumatoid arthritis is if you are pregnant. I'm not talking about the guys now. If you're pregnant and you have never had rubella, this freaks the doctors out. They can't give you a rubella immunization when you're pregnant because they know that's going to injure your unborn child. So what they used to do was they wait till the day you delivered, the minute you delivered, and they were there. And I remember when I started practice, that's what they did. They injected the mother with rubella, and they injected the child with rubella the minute they were born, because if she got pregnant again, she risks the same problem all over again. Nothing happened to those kids. Nothing happened to the mothers. And the mother, if she gave the children a bottle feed, they were fine. If she breastfed them, they were fine. But what happens when you give an immunization to a breastfeeding mother is you pass with the milk almost immediately, within hours, antibodies against whatever you've been immunized with. When you do that, the child is not immunized, it's sensitized. Have any of you ever had poison ivy? Only a couple. Oh, okay, lots. What poison ivy is, you can eat it. You can roll in it. Nothing's going to happen to you. But the moment a mosquito bites you and a little bit of the juice from poison ivy gets inside that scratch or mosquito bite, the next time you're sensitized to poison ivy, the next time, and you might not even know you touched poison ivy the first time, but the next time you touch it, it doesn't have to get inside, it just has to touch your skin. You get this incredible reaction. You've been sensitized to poison ivy. And until you're sensitized to poison ivy, it represents no danger. What happens with rubella immunization is the child is sensitized. Nothing happens at all to that child if it's a boy. Don't know why. But if that child is a girl, when she's in grade 8 in Canada, she gets a rubella booster. Because usually 8 and grade 9, puberty has arrived. That means they can get pregnant. They haven't had rubella, or they don't know if they've got rubella. It's cheaper to give everybody a rubella vaccine. The moment you do that to a girl at that age, she then has an internal autoimmune reaction, just the same as with poison ivy. But in this case, she develops rheumatoid arthritis, serious rheumatoid arthritis, and she can die from it. This is 12, 14 years after the original insult. So when you're thinking of what triggered my ME, what triggered my chronic fatigue syndrome, it's possible it was 10, 20, 30 years before. And this is why a genetic and a good history of the patient is so important. And why it's very difficult for you to expect a doctor to do this. We do it. It's insanity in terms of financial return. But it's a lot of fun because we start to put pieces together over the many years. Zika syndrome, Sjogren's syndrome, this is really a dryness of the mouth. Sjogren's is a very serious rheumatoid disease, but minor forms of it are called Zika syndrome. And again, this is where your vagina is dry, your eyes are dry, your mouth is dry. These are all associated with fibromyalgia. So that just gives you a little bit that fibromyalgia is not a disease. It can be any of these things plus a lot of other things. I mentioned these. I just picked up a Marfan syndrome. He'd seen over 7 doctors in the United States and Canada. And I didn't want to see him because I was too busy. And so I said, well, I'll give you 2 hours I can't afford any more time. And maybe I can make some suggestions. And he was a bit strange, and my secretary came in and went like this, I think this guy's cuckoo. And he wasn't cuckoo. He was wonderful. He was a master's degree in electronics, and he'd been working in the States, and he'd fallen ill, and he ran through all of his money. He was working, making $100,000 a year, and had to come back to Canada where there was free health services where he came from. And he just hit the door of my office, and I said, wow, he had spider hands. Does anyone know what spider hands are? Oh, no, you don't have spider hands. Spider hands are beautiful. They're long, long fingers. I mean, you look like Spider-Man. Not the guy in the movies, but, I mean, these are great. This is a sheer sign of Marfan syndrome. Marfan syndrome, they usually all die unless you replace their aorta in their teens and 20s. But they have all sorts of fascinating stuff. He had been seen all the way growing up by doctors in Canada, missed the fact that he had Marfan's. He'd fallen ill in the States, seen 7 top doctors, spent over $100,000. Nobody noticed he had Marfan syndrome. So you have to examine patients. So these are all really important things. Oh, the biggest cause of fibromyalgia. How many have fibromyalgia who are on statins right now? Nobody? You know what statins are? They're the anti-cholesterol medications. Statins, do you have your creatinine kinase examined every 3 months? Then do it. Because that is usually the cause of fibromyalgia in all of these people who take statins. Statins will actually melt the muscles. It's called rhabdomyolysis. I can never pronounce things. CK, creatinine kinase. And that's a good test for everyone. It's really cheap, costs nothing. In Canada, I think it costs $5, $10. And it's paid for by our system. But what it is, it shows any muscle inflammation. Well, not every muscle inflammation, but most muscle inflammation diseases. And so it's a really easy test to know. And if you are on statins for high cholesterol, you've got to have this test every 3 months because you can destroy yourself on statins. Medications causing fibromyalgia, all statins. All NSAIDs are capable. Cipro, which is a wonderful antibiotic, but you can't give it to kids because it ruptures their tendons. And if you give it to a 20-year-old or 30-year-old and keep them on for chronic infection for a month, they're going to rupture their tendons as well. They just burst with this antibiotic. Nothing wrong with it. Minocycline, same thing. It doesn't tend to burst and destroy the tendons, but it certainly causes fibromyalgia. There was a big thing against women taking estrogens about 5 or 10 years ago, and everybody stopped because they thought it was causing them breast cancer. You get more chance of breast cancer from eating chickens because chickens are so pumped up with the estrogens, a lot more estrogen in chickens than you've got in medication. It's probably one of the reasons why your husbands can't perform, because they've got too much estrogen in them. Thiazides, diuretics can cause it. Alfalfa, which is in a lot of herbal medications, can cause fibromyalgia. So and this is a small list, but there's probably a couple hundred medications which cause fibromyalgia, but those are the big ones. Now this is ordinary people who don't have ME, don't have fibromyalgia, don't have chronic fatigue syndrome. If the normal population, you expect 13% are going to have muscle pain, 10% are joint pain, 8% will have headaches, 5% will develop chronic fatigue syndrome. And those ME patients, our ME patients on statins, over 50% of them will have severe side effects, including muscle breakdown in fibromyalgia. So the pills you take, and we see patients all the time with 5, 6, 7, 10, 20 medications. If you're on a lot of medications, have your doctor send you to a physician who knows a lot about medications as a consult and reduce what you can, because no doctor knows the interactions. You can go with your list of medications to your pharmacist. They've got a computer that doctors don't have, and say, plug in all these, and should I be taking all of them? Are they creating side effects one to another? So this is all important stuff to know about. Now, I'm going to look at ME now. We've finished with fibromyalgia. Was that helpful to anyone? ME is an interesting thing. As I mentioned, it started there. It started with an immunization plus an infection. And this is probably the cause of a lot of ME and CFS people, particularly the acute, but also some of the gradual onset. Gradual onsets are usually a totally different group of people. If you've got chronic fatigue syndrome and you started slowly, it's probably either genetic, medication, or you've got something like an obscure cancer. And it's worthwhile being examined in depth if you've got a gradual onset. Well, it's worthwhile in any chronic illness to be examined in depth. But in terms of individuals with gradual onset, that's usually some treatable disease. And it's really worthwhile to find out what it is. They're the easiest people to treat, the gradual onset. Find out what's wrong. And again, most epidemics in ME have started in hospitals. I've mentioned this before. ME means muscle pain, brain, spinal cord inflammation. And the basis is a diffuse patchy encephalitis. And someone said, well, we don't have SPECT scans here. You got several really good SPECT scans here in town. And you've got a Picker 3000, which is no longer manufactured, unfortunately, but is a brilliant, brilliant machine. You've got those there too. You need a good colorimeter on them, which focuses it so you can actually see pathology in the brain down to 1 centimeter or half an inch. Now, the CFIDS ME Association of the United States is trying to pretend ME and CFS are the same thing. They're not related at all. This, if you want a definition of ME, this is it. Patchy, diffuse brain injury. Wherever you see the blue, that's injury. And this is the base of the brain. Look at all of this stuff here. This is classical ME. And one of the problems when you're doing a brain SPECT, and I have to convince my patients to this because a lot of them are really not well, this is not an X-ray. This is not an MRI, which is an anatomical map of the body. It's part of the body it's examining. This is a functional test. So if you talk to an ME person or CFS person, they'll say, I'm fine if I don't do anything. It's when I try to do anything, I'm ill. Well, you want them to go to this test when they've done too much. Because what we're measuring is the brain that's not functioning when they do too much. So if you go and you're lying on a bed, you're carried in on a stretcher, and you say, oh, I'm too tired, carry me in, and they put you in there, they may not see anything. You got to be tired. You got to be exhausted when you go for this test, and then it shows the brain at its worst, because that's what you want to see, the brain at its worst. This is from our textbook. This is day 1. And this is using a xenon, which is not available anymore since the Canadian government, in their wisdom, shut down the nuclear reactor that made it for the world. But this is a xenon scan on day 1. She was rested. They put her on a bicycle, and they did this test. And she got exhausted, and you can see the holes in the brain, big holes here. This is the left side. This is the right side of the brain. It's read backwards. And so you can see here in the motor cortex and the posterior parietal, or the anterior parietal is what puts together all the visual and auditory information together. Look at well, after the exercise, the next day we did this. She was exercised just before this. She wasn't exercised again. And this is in the textbook there. What you see here is the brain breaking down even more. She didn't do anything. She went home and lay in bed. But she was worse after this exercise. This explains why these people are worse after physical activity or intellectual activity. And day 3, she's even more severely affected. Whole areas of the brain not functioning. No circulation to them. This is ME. This is acute onset chronic fatigue syndrome if it is caused by an encephalopathy. And most people think they had a headache. They don't know that they had an encephalopathy. An MRI, a CT scan will not show it. A spinal fluid taken at the time will show it. A SPECT scan will show it. So you have to know this to be treated adequately. This was my good friend Jay Goldstein and Ishmael Mena who demonstrated this years ago in 1989, and they still haven't got around to doing it as routine in ME and CFS patients. This is a child, same thing happens with children. That child can't function. This is the occipital cortex. In effect, what you're looking at here is a child that can't understand what he sees and hears. Now, here's another thing which you see. In the epidemic of ME that hit Akureyri in Northern Ireland in 47 and 48, 3 children died of ME. And they died as a consequence of getting Parkinson's disease. And you don't see kids with Parkinson's disease, but that's what these kids died of. There were 9, 10, and 11, I believe, and they died within 6 months to a year of falling ill during that epidemic. So this is a serious, but they don't say they died of ME. They don't say they died of chronic fatigue syndrome. They said they died of Parkinson's disease. And this is a typical patient. I see these all the time. This is the first one. It's a bit blurry. That's my fault, not the original slide. But this is the right basal ganglia. This is the left basal ganglia. There isn't any. And this is 2 years later. The left one is beginning to come back, but that's it. I've been following patients for 20, 25 years. They develop Parkinson's disease, mainly the men, not the women. 20 years, 25 years after ME. Not all of them, but too many of them, so there has to be a relationship. And this is the patients we see. It's mainly students, teachers, healthcare workers. Our worst group is the respiratory technicians who get coughed on nonstop. Following or during trips to third worlds, places, particularly if they've had immunization just before they left, never, never have your children or yourself or anybody have an immunization ever if you're going anywhere in the next 30 days. Because even if you sit beside someone in a plane who's coughing with a minor virus, your immune system, because you've had an immunization, cannot handle the contact with that. And there's a good chance, if you get enough of their virus, for that virus to become chronic. And once it's chronic, you've got ME or CFS. And you've got a diffuse encephalitis. So these things are important things to know. And I mentioned earlier, ME, acute onset chronic fatigue syndrome, is invisible under routine neurological examination. And the only way you can see it is with a SPECT scan, a PET scan, beam scan. I mentioned this. And these are all of the epidemics that have occurred of ME, which they have recovered an enterovirus. So there's no use looking for dozens of different viruses of causing ME. We know what it is. The trouble with enteroviruses, there's no patent on it. And so there's no patent, meaning you can't make money on it. So when you produce a virus like the mouse virus in the Whitmore-Peterson lab, they have a patent on that. So everybody in the world who has that test, or herpes virus type 6B or something like this, there's a patent on it by a lab, and they keep pushing these viruses as the cause of ME and CFS. They make millions of dollars every year because they got a patent. There is no patent on this, so nobody is pushing it as a cause. This is some work we did showing the enteroviruses during the '84 epidemic in Lake Tahoe, in North Carolina, in Ottawa, and Montreal. And we didn't find a single enterovirus in the gradual onset ME and CFS patients. Not one. And in the acute onset, in half of them, 50%, we were able to cover this particular virus. So this is important information. But once you've got it, treating it is another matter, because there's no antiviral that they have yet. And I spoke to Roche Pharmaceuticals, who were one of the world's biggest antiviral people, in Switzerland about a month or so ago, and they still didn't have anything. Now, this will not definitely solve the problem, but if you look up Dr. Cheer's work, and that's very important, and I think it may be in our recent book, Misdiagnosis. Dr. Cheer, for the last 10 years, has been showing that people with acute onset ME or CFS often have actual living virus, not just the antibodies, but the actual virus alive and well in the stomach mucosa. And doctors go in because the people are complaining of tummy pain, and they go in, they make the biopsy, and they say, oh, there's no cancer. Or no, there's no bacteria that causes ulcers. But they don't check for enteroviruses. He does. It's an inexpensive test. And in case your group wants to send any samples, I think it's $150. But if you've had a stomach biopsy done for any of these things, what they do is they store the stomach mucosa in paraffin block. You know, the stuff you put on the top of jams and jellies when you're making, they store it in that. And it keeps forever. And they keep these samples in Canada, I don't know about the United States, for 20, 30, 40 years in case they've missed a cancer and they go back and check it again. So what you need to do is you need a slice of that paraffin block. It can't be a fixed specimen. It can't be preserved for light microscopy. You have to get the original paraffin block, take 2 or 3, preferably 3 slides of that, and send them off to Dr. Chia. And I think he charges $150. I'm not certain of that. It should be done with your doctor, because then they send back the photographs, which I think we've got here. There's normal stomach mucosa. That's a young woman with chronic fatigue syndrome, with a fatigue syndrome. Everything is beautiful. This is a girl who had a recombinant hepatitis B immunization. She had her master's. She had a summer job working in a hospital in Kingston, Ontario, and she had to have hepatitis B immunization, but she had a minor infection. It probably was an enterovirus. The two things together, the immunization plus this minor thing, she fell ill. She's now 37. This is 12 years later. She's still housebound. She's got severe dysautonomia, severe chronic fatigue syndrome, and we got that out of her stomach. And Dr. Chia has a treatment for that. We've just started treating patients with it. So far it hasn't worked, but he's got another medication that he adds on to that after it doesn't work for 6 months. But he's had some total cures. The medication he uses is an alternative medication, Chinese medication against viral infections. And he's had, not enormous, but he's had 30 or 40% success rate. That's Chris. And that's what she looks like. And she's wanted me to show these slides, and with her stomach and her picture. And this is Robert. And that's his stomach, and here's Robert. Robert doesn't look like it, but he's got a job in the federal government where he's earning over $100,000. He was injured by two things, and I'm going to finish up now after this. He worked, first of all, in the Pickering nuclear generator in close to Toronto, and he was exposed to 3,000 rems of radiation from the nuclear tubes. And he fell ill. And then in 2004, 2005, he had the influenza immunization, which was contaminated with Serratia marcescens. Now, does anybody know about this virus? Serratia marcescens was used by the American military, and they sprayed it all over Los Angeles and all over Brooklyn, and they put petri dishes on top of all of the buildings they could. They wanted to see how good their germ warfare spreading was. You can read this, you Google it, it's all there. I mean, there's no secret about it, except the newspapers don't seem to print it a lot. And it was a plant. Serratia marcescens had never been known to injure humans. It was a plant bacteria. So they thought, there's no problem spraying this. Well, several people in hospitals in both places died with pneumonia caused by Serratia marcescens, and they don't know how many people fell ill. Well, this was produced in United Kingdom and England, this vaccine, and supplied all the influenza vaccine for America and Canada and Europe, and it was made there because they were able to produce it cheaper than the Americans and Canadians and anybody else. And it was contaminated. And they told the Americans, they told the Canadians as early as September that their immunization was ruined by, contaminated by Serratia marcescens. And Canada and the United States didn't withdraw it until February, even though they knew for 6 months. And a lot of people developed ME and chronic fatigue syndrome after this. Again, you've had this recent problem with a Massachusetts lab, I believe. The present flu epidemic of immunization has been withdrawn in Europe because it too is contaminated. So they don't tell you this, but you can Google it and find it. They're not giving it in Italy. They're not giving it in France right now. Because it had particles, they didn't say what the particles were. These are patients who came to me with chronic fatigue syndrome. I've met dozens with vascular disease of the brain, dozens with carotid and vertebral artery plug, which all we had to do was clean out and they got better. I had an American general from the Marines who came to me, and she'd been for 6 weeks in the big military hospital in Washington, and they said she was just too fat. And when we examined her, on the first day, we found that both arteries in the back were totally plugged. One of the carotids in the front was 100% blocked, and the other was 90% plugged, and we didn't know why she was alive. And I phoned her base, and they wouldn't touch her because they said she's going to die and it'll ruin our statistics. And I phoned my nice guy here at Harvard who got me started in this, I said, what do I do? He says, send her down. They brought her down. And I told her she's going to be dead within the next few months. If she doesn't have the operation, if she has the operation, there's a good chance she's going to die on the table. She's 6'6". She weighed about 400 pounds. And her argument was, well, my two sisters are bigger than I am and heavier than I am, and they're not fatigued. And she was speaking like a general. And so we got her operated, and she survived the operation, and she sent me Christmas cards for about 6 or 7 years after that. I don't know if she got bored with sending me Christmas cards or she died. But the point is, once we got her arteries cleaned out in her neck, she was fine. So you have to examine these people. These are all the things we find in these people who think they've got chronic fatigue. We had a professor at university in Canada who came, and he said, I fell ill after a immunization against encephalitis. And we examined him. He had tertiary syphilis, which was eating away at his brain. He'd been going to bed with his patients. He'd been going to bed with his students. He'd been going to bed with his wife. And he had tertiary syphilis. We've picked up 2 syphilis. Doctors don't check for syphilis anymore. We check for everybody for syphilis. Lyme disease, brucellosis, von Economos. It's supposed to have disappeared in 1930. We have von Economos patients. They don't come to your office. You have to go to them because they're asleep. So all of these things, Eastern Canada, Northern Canada, Western United States, metal and chemical poisoning is rife. And I promise this is the last. Nobody has examined not the patients who's fallen ill, but the patients' relatives who were with them when they fell ill. And in Klein Village, we all know the doctor who just had his heart removed. He was one of the 2 doctors in Klein Village. ME knocked out his heart. He didn't come down with ME. He came down with chronic heart failure. Blood malignancy. This has been common in not the patients with ME, but in the people related to the people there. North Carolina, Grufferman's work in the symphony orchestra. 1/3 of them fell ill with ME, 1/3 of them nothing happened, and 1/3 of them came down with blood malignancy. And we found cardiomyopathy, blood malignancy, type 1 diabetes, and all of this in the cohorts, not patients, but their immediate family who fell ill at the same time, but not with ME.